Okay. All right. Hey, everybody. So I'm just gonna, since we're a couple minutes late, I'm just going to get started and people will probably pop in as we go. Um, so I'm here, I'm Marin Campbell for anybody who doesn't know me well. I'm here with the Denver Holistic Health Collective, and we're just doing our monthly Zoom with members, and I'm here with Jessica Klain today. She's a physical therapist and a vestibular specialist. And I'd love to just start by giving like a little overview of vestibular. What is under that umbrella, and how do you describe yourself when you talk about it?
So I'm going to preface this by saying I'm going to try to stay really high level with this and give like the most helpful information, not just as healthcare providers in this group, but just as, people that have neighbors and family that may have concussions or vestibular issues. So the concussion is, we're going to talk a little bit more about the brain, but also they affect the sensory processing systems like the visual system, the vestibular system, and the proprioceptive system. The vestibular system is it is fun and it is complicated and it's a really big puzzle, which is why I think I'm drawn to treating that so much. But technically, the vestibular system is your inner ear. But how the vestibular system communicates with the visual system, your neck, your balance, and your brain is just extremely complex and is so important for just our day-to-day function that it can affect so many different things and create so many different symptoms that can be really intrusive to people's lives.
Yeah. Well, thank you for that. And yeah, I know it's like a balance act between trying not to delve too much into the details, but I think it'll be great for everyone to get a little a better broad sense of what you're talking about. So yeah, with that, I'll just let you take it away. I can see your slides, so you are good to go.
Great. So my goal of today is, again, just to stay high level on concussions and being able to recognize when a patient or a family member might have one and what you can do to help them. Um, so let's see. I guess to answer Marin's second question, a little bit more about me. I am a physical therapist. I grew up in New York, but I've moved all over the country and I actually lived in Thailand for a little bit where I didn't work. I actually thought maybe I wouldn't come back to physical therapy after I took a year and a half off, but it was actually at that time that Marin and I were introduced via Zoom and DHHC first started back in 2020. And I think taking time off and just connecting with other providers that were feeling similar to me about the healthcare situation that we're in really inspired me to move forward and just go out and work on my own. So I wasn't being pigeonholed into the traditional healthcare model. Um, so prior to taking a year and a half off, um, I spent a lot of time getting a lot of extra education. So the two most important things that I spent time doing was getting a manual therapy certification, which has really helped with recognizing and treating neck generated vestibular issues, but also anytime you have a concussion, the neck is always involved. So I feel really confident in helping people manage that component of concussions. And then the other really important thing that I did was get concussion and vestibular certified back in 2014. I've also spent time doing dry needling And then it was actually in Thailand that I did my yoga instructor training, mostly because I was bored, but it ended up being really a life-changing experience. So I really enjoy working that into, the umbrella of physical therapy, but it's so much more than that.
And you incorporate yoga into concussion programs as well, right?
Exactly. So, um, I like to think of yoga as being as we can use yoga in two very distinct ways from a concussion perspective or any sort of vestibular perspective. Um, if somebody is really riled up in their symptoms, yoga is such a good way to just calm down the nervous system, really cue into the parasympathetic, where we are doing more grounding and breathing, and just gentle movements. And it can be used to habituate to movement. So people are sensitive to bending over, sensitive to turning. We can use yoga in a very repetitive way to retrain the brain to accept those different movement patterns and allow people to then move through them without symptoms. So it's a really fun way to use something that I think people feel more safe with, but also like more willing to do. It's not a physical therapy exercise. I'm not giving them like one boring movement pattern. It's incorporating so much more. So that's been a really, really good addition to my practice. So coming back to concussion, a concussion is a very complex thing, but if we really get into the nitty-gritty of it, it is an inner injury that at the cellular level create it. There's chemical changes that happen, which then interfere with how your different brain cells communicate with each other and therefore different parts of your body. So, because any cell in your brain can be injured during a concussion, that means that the symptoms that each person experiences can be so widely different. So, I listed the most common concussion symptoms. Usually, it's not just one. Usually, it's a combination of several of these things. And they can they can show up, 2 days afterwards. They could show up 3 months afterwards as well. So even though these are common, every single person is just going to present so differently. And so if you're not sure if somebody has a concussion, if your gut feeling says, I think you have a concussion, they probably do. And we'll talk more about kind of what the next steps are. I think one of the most common misconceptions with concussions is that you have to hit your head, and that is untrue. You could have any sort of whiplash injury that still creates enough force for the white matter and the gray matter, which are made of different densities, to have enough force to create shearing in your brain. And that's what's actually causing the damage. So if you hit your head, yes, you might have a concussion. If you don't hit your head, you also might have a concussion. If you do have a concussion, you definitely have whiplash at the same time. So, other common concussion myths. So, unfortunately, well, let me start with fortunately, I do think that the concussion research that has come out in the last 10 years is so much better, and there's so much more of it that we are learning more in the last 10 years than I think we learned in the 50 years prior. Um, and there's still a lot that we don't know. I mean, there's so much about the brain and concussions we don't know. Even though there is a much better awareness of concussions and we have more research, I still see patients that have gone to urgent care or the ER or their primary care, and they were told that they need to sit in a dark room until their symptoms go away. And we call that cocooning, and that is not true at all. Do not ever tell somebody that you suspect that has a concussion to just sit in a dark room until their symptoms go away. The other common concussion myth is that if you have no symptoms, you are fine and fully healed. That is completely untrue, and I'll go into that with a little bit more detail in the next couple of slides. Again, another myth is that you should avoid all exercise and activity. That is actually going to inhibit the cellular brain healing. If we don't move or we don't do anything, we actually become more sensitive to movement. It's kind of a use it or lose it type of thing. If you're not moving and exposing your brain and body to inputs, then your brain can see those inputs as dangerous and therefore symptomatic. So we do want to do something. And then this is interesting because it's opposite of what we usually expect, in that children don't actually heal faster than adults. So, kind of flipping the script, what are the actual facts here? So, we don't want to cocoon in a dark room forever and ever, but we do have to treat a concussion as an acute injury. And so for any acute injury, just like a sprained ankle or a broken bone, we want to kind of baby it for the first day or two. Maybe that does mean minimizing light, resting more, but you're still doing stuff. You're not just sitting and doing nothing in a dark room. About 80% of people do recover within 7 to 10 days. And I think that's a little bit of a misleading statistic for a couple of different reasons. But I think that this is what's put out into the world because of things like the NFL plays Sunday to Sunday. That's 7 days. So they are promoting that if you have no symptoms within 7 days, football players are allowed to play in the next game. And we'll go into another slide where that we have information that indicates that that's actually a really terrible idea. We do want to initiate that gradual movement and activity within that 1 to 2 days. So the timeline is minimize exposure for a day or two, but then within a day or two, we have to start moving. And that looks different for everybody. And then children heal slower, right? And that is because their brain is still developing. And because it's still developing, it's actually more susceptible to injury. And their typical timeline is more like 4 weeks to have that initial recovery versus that 7 to 10 days. So this is a graph of a rat study. So what this is looking at is what's happening at the cellular level, the changes that occur after we create a shearing force through brain cells in rats. And this study indicates that we have a metabolic depression for up to 10 days in adult rats. So that's 10 days before the cellular function really starts to recover. In humans, using spectroscopy, we know that athletes that say that they have no symptoms from 3 to 15 days, their spectroscopy studies aren't normal until 30 days. So publicly, we're getting this message that 80% of people heal within 7 to 10 days. But when we really get into the research of what's happening at the cellular level, both in rats and humans, we're saying the cells aren't recovered until an average of 30 days. So if you're symptom free at day 7, you play football, you go skiing, you slip and fall on the ice again, and you sustain a second concussion, that second concussion can be so much worse than the first one. It's not like, oh, I have one mild one and I have a second mild one and now I have two mild ones. It really is, I can have a mild one, I can have, in theory, a second mild one. And the combo of that is like a year of post-concussion syndrome symptoms. So I am always extremely conservative when talking about getting people back to sport or activity afterwards, because I just think that the risk is so high for creating really, really prolonged symptoms when maybe we just need to sit out another week or two and just be a little bit more patient. So you suspect somebody has a concussion, you're like, should we go to the ER? Should we go to urgent care? What do we do? The essential first thing that you do is you communicate with the person, hey, I think you have a concussion. These are the red flags that we need to be aware of. And if any of these red flags show up, you go to the ER right away. And the reason why you would have to go to the ER is that you would want them to do a CT scan to see if there's a brain bleed. So the red flags that you're looking for is loss of consciousness, vomiting, an increase or change in a weird headache. So, some of us get tension headaches or things like that. It's not that type of headache. It is like a serious headache that is not normal. If they have any sort of slurred speech or they're confused. Any of those show up, you're going to the ER. I would skip urgent care, honestly, because they're not going to have a CT scan. If you go to urgent care, they're probably going to send you to the ER anyway. But if you're monitoring those symptoms and 24 to 48 hours go by, none of those red flags show up, then we want to prioritize rest and sleep. So a common thing that patients will tell me is that they try to power through their day so it doesn't screw up their sleep at night. And I think that is the wrong approach. If your brain and your body is craving sleep the first couple of weeks after a concussion, sleep. It doesn't matter when, it doesn't matter how long, the more the better. The sleep and the rest, that is the healing time for the brain. So I don't care if people are sleeping 15 to 16 hours, that's what the body needs to heal. And then ideally, we want to see anybody that has a concussion ASAP. The magic number in the research is within 7 days. But what I am seeing a lot is, somebody goes to their primary care, they go to urgent care, or they read on the internet, 80% of people recover with 7 to 10 days. And so they don't get actual concussion care. And then they're way more likely to end up with prolonged symptoms. So that's what this graph is depicting. So it's important to recognize on this graph that there's a lot of dots on here because everybody's recovery is very, very different. But the statistical significance of this graph is that people who initiated clinical care within 7 days recovered faster than those who initiated care at 8 days and after. So the green dots are the people who sought care within 7 days, but you can still see some of those green dots are 200, 250, and 300 days to recover. So it's still not magical, even if you get somebody in within 7 days. But again, the statistical significance is if you get somebody in to see a concussion specialist within 7 days, statistically, you will recover faster. So when I see patients, I ideally want to see them within the first 7 days. And if I'm seeing them within the first 7 days, it's a lot of education. What should you do? What should you avoid? What are you doing to promote healing? Um, what are the risk rewards? Do you have to go back to work? It's everybody's different, and a lot of those sessions are just a lot of talking so that the patient really understands what's happening and they can make good decisions for their own healing. And then again, if they have a concussion, they definitely have whiplash, so we're doing a lot of neck treatment. um, I will do a full evaluation on visual processing, vestibular, and proprioceptive and see what has been affected and how those different sensory systems are integrating together. And then if they're having trouble with exercise, so exercise intolerance related to changes in heart rate and blood pressure can be really hard post-concussion. So we'll do a very objective test called the Buffalo Concussion Treadmill Test, which gives them very specific guidelines to follow based on heart rate for exercise. And then return to activity, it's all based on symptoms. And the bottom line is if people are pushing through their symptoms, they are not helping themselves heal. Concussions are not something that you just power through and get better. You definitely want to push the limits sometimes, but it's really important to um, kind of dial it back when you need to. So then Marin had already asked a little bit about kind of how I integrate yoga into treating concussions. And so this has just a lot to do with regulating the nervous system. And concussions they're scary, honestly. And because we can't see objectively what's happening. There's no swelling, there's no redness, there's no loss of range of motion. That kind of unknown, I think rightfully so, can create a little bit of anxiety of not knowing how long it's going to take to heal. So, yoga is just a great segue to give people something helpful for the healing process, um, but also something that's like known and comfortable. So there's so many different ways to use it, and it's such a great adjunct to traditional PT and other treatments. And then wellness. So this really comes down to how are we approaching how that person is moving through the world to let themselves heal. And these conversations can kind of go off the rails sometimes with people, but it is just so important to do some of the basics that we should be doing for ourselves anyway, like eating healthy, specifically. People post concussion will have weird cravings. And I'm kind of like, give into those cravings. I don't care if you're eating Pop-Tarts because your brain is craving sugar, and it's craving sugar because it needs glucose to help heal. So eat the Pop-Tarts. I don't care as long as you're eating something. Sleep, like I said, is so important. And napping and sleeping longer, if people can work that into their life, it should be. Supplements, I'm going to mention Allison a little bit later with Wild Rice Wellness because she's a great resource for supplements. But my general recommendations off the get-go are like a regular multivitamin, a multi-mineral, vitamin D, vitamin B, magnesium, and NAC. Just giving the brain some of the building blocks that it needs to heal. But there's a lot that can go into the supplement side of thing, both from the acute perspective, but also more for chronic issues. So one of the reasons why I really got into concussion and vestibular is because I was living in Alaska, working in a clinic, and I was seeing a lot of whiplash, upper cervical headaches post-car accident. And I kept seeing these patterns that weren't accounted for. And it turns out everybody had it, not everybody, a lot of people had concussions. So that's how I originally got really into this niche treatment of concussion and vestibular. And one of the things that frustrated me the most is that primary cares did not have great knowledge to know what to do with people. So the longer that I was treating concussions and vestibular issues, it really felt like I was becoming the case manager for these people and figuring out where they needed to be referred to and why, but also what was the expectation that that patient had going into it. So the most common provider that patients are referred to are the neurologists, but a neurologist takes 2 or 3 months to get into, and consistently patients are very disappointed with that appointment because they don't feel like the neurologist does anything. So neurologist usually is not my first place to refer for a concussion, but it is somebody that I like to have on the team if there's chronic conditions going on. So the way I describe it is the neurologist is the person on your team that makes sure that nothing's going to kill you. Like, you don't have a brain tumor, you don't have a brain bleed, it's not a stroke, but maybe they'll give you some medications, which there is a role for medications, and the neurologist is a good option for that, but there are other ones. If I'm seeing somebody with chronic vestibular issues or vestibular issues that aren't resolving with traditional vestibular therapy, the I can never say their name, neuro-otologist, they are just more highly trained ENTs. But ENTs are way easier to get into. And I usually use them for hearing tests. I want to make sure that that vestibular cochlear nerve is still firing well. But there are some other specific tests like calorics, VNG, and VENS that can give us some objective information about the vestibular system that can be helpful. I still like to have a PCP on board, even though I don't necessarily trust their depth of knowledge on concussions, but they're really great for managing comorbidities and just overseeing the general health of the patient. And these are more my typical referrals. The neuro-optometrist, speech therapy, acupuncture, and massage, this is where I feel people are going to get more of their functional gains. Neuro-optometrists and speech therapy in particular. I think that the combo of vision, speech, and PT for anybody that has symptoms longer than a couple weeks, that is essential. That is baseline. Acupuncture and massage are kind of extra from a nervous system perspective, and I think that there is so much value in that. The biggest issue patients have is they have a concussion, so usually their bandwidth is not very high, right? If they're sleeping 15 hours a night, driving might bother them, they're irritable, they're fatigued, whatever combination of symptoms they have, going to a lot of appointments every week is just unrealistic. So it's really important to pick what is the most important at that phase of recovery, so it's manageable and it's doable. And that is different for everybody, and it usually evolves through the case or the duration of treatment. So I've kind of alluded to this. Concussions, um, most people are going to be fine within a few weeks, and they do not need prolonged care. But there's enough people that unfortunately develop post-concussion syndrome, which technically the definition is having at least 3 of these symptoms on the list: headaches, dizziness, fatigue, irritability, sleep disturbances, concentration or memory problems, and increased sensitivity to noise or light. If somebody has 3 or more of those symptoms for more than several weeks, and certainly if we're getting into that 3-month range, then we put the label of post-concussion syndrome on them. And this is a chronic response to a concussion. The brain is not doing a great job of healing itself, and we need to manage the symptoms so that people can move through their life as best as possible, but also still work on that healing process. Earlier on in my career, I would tell people that they had about 2 years of ideal healing time frame. I don't say that anymore because I don't really believe it. I do think that the sooner people heal, the better, obviously, but I have had people that has had post-concussion syndrome for 10 years, and doing some things to treat it, they can still get better. The brain can always heal. We just need to create the environment and create the stimulus to heal. So, just like a concussion, post-concussion syndrome can just present in a variety of different ways, and it can really be a very difficult thing for patients to just manage. And a lot of times with PCS, I will recommend them see a mental health therapist as well, ideally somebody that has experience with concussion, because PCS, I end up having a lot of conversations about like their parents or their spouses not understanding, and feeling like they've lost their life or they've lost their identity, and a feeling of hopelessness. Um, so it's a lot to deal with in a lot of different ways. But like I said, I think no matter what, there's an opportunity for people to get better and to improve. So PCS, because, it originated as a cellular brain injury, and depending on what cells were injured, it affects different areas of the brain. Um, that means that there can be a lot of um, other things that develop afterwards. So POTS and mast cell activation syndrome, I'm seeing that a lot more now, and I think that there's maybe a COVID viral influence associated with that. Triple PD, that is persistent, what is it? Persistent postural perceptive disorder. That is much more neck generated. Exercise intolerance kind of goes a little bit hand in hand with POTS, the dysautonomia, and then headaches are a really, really big one. And there's so many different types of headaches, and luckily we've had uh, a lot of new migraine medications that have come to market in the last 5 or 6 years, and that has been game changing for some people. So hopefully that all made sense. But I think the most important things to take away from this information is that Concussions are defined as a shearing cellular injury between the white and gray matter of the brain due to either an impact or just a rapid force counterforce to your brain. But everybody is just so different. And that's why I'm saying gut feeling, if you think it's a concussion, recommend they see somebody that knows about concussions sooner rather than later. Ideally, for most people, it would be a one and done appointment, just saying, okay, these are the things you can do to help yourself heal. And then if, a couple weeks after that, they feel great, they can start getting into more activity and then they're fine and great. But for those 20% or so of people that don't heal in the first couple of weeks, getting them in sooner rather than later is such a game changer for them. And if they are not recovering within the first couple of weeks, having this multidisciplinary team is just so essential for full recovery. And kind of picking and choosing who they need to see and when and why and what the expectations are. And then avoiding the second impact syndrome. Having a second concussion within those first 30 days can just be really it can be just so detrimental to possible healing. So I don't, you know, I never want to scare anybody of like, don't do anything, because obviously I said we need to move and be active to help with the healing process, but we do have to consider that risk reward in terms of getting back to activity and trying to avoid having that second concussion. So this is my go-to list. So on the left, these are community resources. UC Health has a really, really great concussion team and program. They're just really, really hard to get into. You're not getting in there within the first 7 days. So they're great for more chronic conditions, but they don't have the bandwidth to get people in right away. Love Your Brain, they're yoga-based online. I'm working with a couple of PTs in the Pacific Northwest on doing more education from the experts and encouraging people to move and exercise. And that program is called Balance Works. I do some work with a gal named Sylvie out of Europe, and she runs a concussion community. And then Brain Injury Alliance of Colorado and MindSource, they have a lot of financial programs for people who maybe have lost their job because of a concussion. Like they'll help pay rent, they'll help find different care, set you up with free Uber rides. They're not well organized, but they do good things. And then everybody on the right list, these are all DHHC members. Not everybody is specific in the concussion world, but all these gals are helping different aspects of people that may or may not have a concussion. So I, again, try to stay a little high level. I could go on forever and ever about most of these things. So if there's any specific questions that you have that maybe you want more information on, or any patients that you might have in mind, any form of contact listed on this page, I am definitely open to that. And then any questions?
Thanks, Jess. That was great. Um, I'm going to start with just a quick question, which is like the treadmill test. I'm
Mm-hmm.
curious what that looks like. I'm like thinking about just like an exercise capacity test, and so I'm curious if it measures like when the symptoms come on compared with like heart rate and things like that.
Yep, exactly. So I will send it to you. So when you send out this recording, you can just send it as an attachment. It's super easy and it's very objective. So the test is usually only takes like 10 to 15 minutes. It is a constant speed, which depends on your height. There's two different heights. And every minute you go up 1% in incline. And every minute you test heart rate, RPE, and ask about symptoms. And once they get to the point where they've had, I think it's an increase of 2 points on the 10-point system scale, you're supposed to cut them off. In theory, patients can do this themselves. What I have noticed with every single patient I've ever done this with is that they try to power through it. They're like, I'm fine, I'm fine. And you can tell on people's faces, you're not fine. We are stopping because we need to get this heart rate measurement of when your symptoms came on. And then we develop an exercise plan that really, it doesn't allow them to go into that heart rate symptom threshold. So it's very useful because it gives a person objective data on how to exercise. Because we're saying you have to exercise to help the healing process. But if they're exercising at too high of a load, then we're actually doing harm to the healing process.
Mhm. Yeah, and it's so nice to have the objective reason for them that they can just
Mm-hmm.
sort of lock in with instead of just this like nebulous, range of days. Any other questions?
So it looks like,
Did you see
Meg,
Meg?
I should have included you on my list of DHHC resources. Um, I love to have new resources for people because, I think that it's hard to get people in with people that actually know kind of know about concussion, really.
Yeah, definitely. Sorry, I just put a plug. I'm new to the group. I just joined and still have to fill out my bio and my blog. But I'm Meg Branston. I'm a neurologist at UC Health. So if there's any complicated patients that you need, I'm happy to get them in sooner than 2 to 3 months, sometimes 4 months.
Good.
So I understand the challenges of getting people in, but just want to introduce myself since this was on topic with my interests as well. Thank you for the
Awesome.
great talk.
Thanks, Meg.
Hi, can you hear me?
Yep.
Hi, my name is Anna. I'm a new in the group too, and the conversation was very good. Actually, I just want to know a little bit more and maybe knowing if I can send an email to my son. So my son went to Europe to play soccer there, and the first week he was there, he got a concussion. And I called him yesterday, and they tell him that he has to wait for a week to rest for a week, and he had already passed a week. So I called him and he said, "How are you doing?" "Yeah, I think that I'm gonna take another week, Mom. This is not the first concussion that I have, but I think that I saw him very bad." So I was, wondered today. I'm like, maybe he need to talk with somebody that specializes in concussion to really, because he's gonna be there for 6 months, and the idea he was gonna go there to play soccer, and if he doesn't recuperate very well, I don't want that to damage the stay that he's going to be there. So maybe it will be interesting for maybe sending your request, your information. Maybe he can contact you by email or something like that,
Yep.
if you don't
Definitely.
mind.
Yeah. That
Okay.
sounds like, he's in this prime timeline of healing. But if he's having prolonged symptoms, kind of figuring out what else he can do to help that healing process move faster
Yes.
and definitely
Yeah.
be a complete healing process as well.
Okay, great. Yeah. I will definitely give him your information for him to contact you, because, if somebody else say it, it's good. But if I say something, I'm the mother. He's never going to pay attention to me. So forget about it.
Any other questions? Cool. I see in the referral, Jen has sent you somebody, so maybe you'll get someone from the Total Health Solutions Clinic. Yeah. Cool. I just love the plug too for mental health referrals. TBI, it's such a, I just feel like they fall through the cracks, right? Because it's like, oh, well, we're addressing all your medical symptoms. So it's just a matter of time until you heal. But that sense of disconnection from like life and just sense of self, it's
Mhm.
just having some even temporary support around that, or talking to professionals like you who can at least say, yeah, that's a thing. Like it's not just you.
Right. And it's interesting because I mean, I think this is true for both concussion and non-concussion patients, where as a PT, I get to spend a lot of quality time with people. And, I pride myself on really trying to create an environment and a relationship with my patients where they feel like they can trust me. And sometimes I'm actually surprised at some of the things patients tell me. But also the more that they share, sometimes it's really obvious that they are struggling in life. Um, and, you know, being an encouraging person on a human level, but also a healthcare professional that is treating them, encouraging them to seek some sort of counseling, I think is is a missing link in what like primary cares can do for patients because they don't really get to know them that well. There's not that level of relationship or that level of trust. Um, but the most common comment I get from patients is they're like, "Well, are you telling me this concussion is like all in my head? I'm not making it up." I'm like, "You should know that I know that you're not making it up." Um, but it is part of the healing process. And I mean, there's some really interesting data about people who have been diagnosed with depression, anxiety, and bipolar prior to a concussion are more likely to develop prolonged concussion symptoms after the fact. And then on top of that, anybody who's had a concussion, even though they've never been diagnosed with a mental health condition beforehand, post concussion, there's a higher rate of diagnoses. Now, I think that there's a lot that can go into that. Like now they're seeing more medical providers. Maybe they were going to be diagnosed with something anyway. My gut feeling is that the cellular changes that occur after a brain injury create an environment where some of these things that maybe were subclinical beforehand and could have been, mild depression, you can cope with it. Maybe mild anxiety, you can cope with it. But then you have this injury, and now your coping mechanisms are lost or changed. But also, what's happening at the cellular level has been disrupted, which is what some mental health conditions are. So it can get complicated. And unfortunately, a lot of patients are just resistant to it.
Yeah. I have another question, if you don't mind.
Sure.
I right now I'm an occupational therapist, and right now I'm seeing a patient, and he had concussions his whole life. He was working construction. He fell from a ladder, hit her head many times. And right now, when I start seeing him, he haven't seen anybody, but he was falling every single day. So, and he had a lot of balance difficulties. They have been doing a lot of surgeries from him, like knee surgery, hip surgery, back surgery, neck surgery, and anything like that. But I think that he hasn't, realized that it's probably a lot. After seeing, hearing you, it's probably a lot of the concussions that he has that nobody have been paying attention to. That they have been paying attention to their muscle, the bone that is broken, everything, but not to this, because he continued falling. He continued having a lot of vertigo and a lot of falling and a lot of balance. That I have been doing some things for him for ADLs, adapting the house and stuff like that. And I wanted physical therapy actually to see him, because he is but he's at home, so I don't know. There, he cannot drive very much and things like that. So I am seeing him at home, but I think that one of the problems that he has is the vertigo and the concussion that he have been having his whole life. And a lot of people say, no, you have something in your brain and you're gonna die from that. I'm like, whoa, okay. So anyway, but I thought that it was very interesting. It really opened a lot of things for me. Oh, maybe she's a PT. I'm looking for a PT for
Yeah,
him
I
anyway.
mean, just based on that, there's probably something going on with his sensory integration system. Like his visual and vestibular system aren't talking well to each other. The vestibular and proprioceptive system are not working well together. And so if your sensory systems are telling your brain something different at any given moment, that can be confusing to your brain and lead to very specific patterns of loss of balance and falling.
Yeah.
And that's the puzzle of it, really, where so many different aspects of these automatic systems like vision and vestibular and balance, even heart rate and blood pressure can be affected by a concussion. And we have to figure out what exactly is affected. Like you've already mentioned, what are we going to do to compensate for it? Like changing the house so it's safer, but also what are we going to do to promote these systems to work better moving forward so we don't have to just live a life of compensation?
Yeah, exactly.
Mm.
So do you have your clinic? Are you here in Colorado?
Yep, I am in Denver. I'm in the Santa Fe Arts District.
Okay. So maybe you can be my PT. My
Yeah.
can be my PT that I've been looking for because I have been looking. He lives in Lakewood. He might
Mm.
be able to drive to where you are, but I definitely have to find a PT because I just bump into a wall. I'm doing a lot of exercises with him. He's getting stronger. Everything is stronger and things like that. But still, when he goes, his birdie goes and fall again. I'm like, oh my God. All right. So I just need to, even for me, for my education on how to help him in his house, I need to realize, okay, what kind of exercise will be better for him for his overall health.
Yeah. I mean, there's so much, like lots of different ways to approach it.
Yeah.
I can
Okay,
send you.
great.
Yeah, I
I'll
can.
definitely will get your information.
Yeah, I'll do a little intro email, and I also have somebody in mind that might be like if he can't get to you, Jess, there's another vestibular clinic. I'm blanking on the name. Meg Payne. Do you know Meg?
I
She
don't.
anyways, yeah. So maybe if location is an issue, I'll just throw that out there. But thank you so much. This was great. I think everybody really good feedback. And I'm gonna share your slides. So if you want to send those
Yep,
to me
will do.
and then if I don't know if that treadmill thing was separate, but
Yep, I'll send you that as a PDF as well.
okay, cool. Just stop recording.